for today, we're going to perform oral care. So before proceeding to the implementation of the procedure, let us first assess the patient's mobility. So sir, I want to assess your mobility. So can I ask you to raise your hands? Alright, put down. And then can you move your feet? Okay, thank you for your cooperation, sir. And after checking its mobility, let's assess its skin condition, if there's any allergies or any skin disease. After assessing the patient's mobility, let's assess the patient's oral hygiene and oral problems. So, sir, I just wanna ask if you have any oral problem records, or what is your oral hygiene for the previous years?
No,
So you don't have any oral problems, sir?
exactly.
Okay, thank you for that, sir. So after assessing the patient, let us proceed to the preparing the materials that is needed in this oral care. So after that, we can proceed to our implementation. After assessing the patient's mobility, let's assess the patient's lips integrity, mouth, teeth, and tongue. So sir, I just wanna ask if I can check your mouth.
Sure.
Thank you for that, sir. So, I wanna ask if what type of oral hygiene do you have at home?
I'm brushing my teeth 3 times a day and also gargle.
Okay. So, after assessing if the patient's oral problem and oral hygiene, let us ask the patient for any types of difficulty to its gag reflex or in swallowing or biting foods. So, sir, do you have any difficulty of swallowing?
No,
How about gag reflex?
no.
Okay, thank you for that, sir. So now let's proceed to the implementation. So this time we already prepare all the materials needed for this demonstration, and after that, let's perform hand hygiene. So we already done performing hand hygiene. After that, let's put gloves on our hands so that we can reduce the risk of transmission of microorganisms. So after that, let us introduce ourselves to the patient. So, good day, sir. My name is Carpenter Lainey K. Marien, your student nurse for today. So, I hope you assist and you participate well in this procedure. And after introducing ourselves, let us identify the patient. So, sir, I wanna ask you your name, your birthday, and your age.
My name is Jay Benventura. I'm already 21 years old and my birthday is November 18, 2001.
Okay, thank you for that, sir. So, after identifying the patient, let us proceed to the procedure. So, for now, let us do the implementation of this procedure. So, first, let us raise the client's head into a comfortable one. So, for this moment, let us improvise because our bed cannot be raised. So, I will use another pillow for the head of the patient. So, after raising the head of the patient to 30 to 60 degrees, let us put a towel on client's chest. After putting the towel to the client's chest, let us proceed to putting toothpaste to the toothbrush. So after that, we can brush the client's teeth back and forth position. So let's allow the patient to rinse his mouth with a small amount of water. So let's use another to after rinsing the client's mouth, you need to wipe the side of the patient's mouth at the edges of the towel. After wiping the mouth of the patient, let's provide dental floss. So after floss, let's allow the patient to have rinse his mouth and spit out the excess toothpaste or any liquid to his mouth to the basin. And after that, let us provide a small amount of mouthwash. So again, let's spit out the excess mouthwash, alright? And then wipe the mouth of the patient. After donning for oral care, let us return the patient to a comfortable position. But first, let us remove our gloves. So after putting the patient into a comfortable position, let us return all the materials and equipments that we use already and dispose it to its designated disposal area. After disposing the materials, let us perform hand hygiene so that we can reduce the transmission of any microorganisms. After a few minutes, let's evaluate the patient. Let's ask the patient if she or he feels uncomfortable or any irritation after the oral hygiene. So, sir, do you feel any irritation or uncomfortable feeling after the oral care?
No, not at all. I'm good.
Okay, thank you for that, sir.